Island Sexual Health has two sort of central programs, one being education, one being clinical. We wanted to be out in the community and doing more prevention. The education program developed from there, and there was a real interest, especially with local schools. School districts in Victoria did used to have school-based educators that went around, but that phased out as money got tight, so we kind of picked up that slack. Someone would phone and say, hey, I'm the counselor at Esquimalt, can you come in and do a class on healthy sexuality or birth control or STIs? So over the years, the program has grown, and now we actually have 3 full-time educators. It's a program that we actually go out and fund for. A couple of programs we've developed, breaking down barriers, created to try and link up with youth specifically in the community that weren't involved in regular classroom life and didn't get the talk, as we call it. Man-Made was a program specifically for male-identified youth that addressed issues around masculinity.
I had this opportunity to get involved with the education program here and developing a program that's called Man-Made, exploring healthy emotional expression and tools for emotions and emotional support, and then also cultivating a culture of consent. Because there's so few guys talking about this, I think a lot of it comes with discomfort, right? Like, it's uncomfortable to critique yourself, it's uncomfortable to talk about identities because it's a big piece of who we are. And that's really what we need to start, is making it okay to talk about masculinity and being men and being boys and what that means for us, and even more importantly, maybe what that means for other people.
It's really grown, and also added on Man-Made Junior, Generation Girl, and Mighty Me's.
When I think of healthcare, you know, you think of like going to see a doctor and taking your medication and going for your checkups. But I think like the more we can front load kind of that upstream approach, like making sure people have skills and knowledge and access to healthy lifestyles and information about health, the less we're going to have to like manage issues, right, that could easily be prevented.
Your center really exists to address needs that aren't being met by other players or other kinds of organizations. I mean, this stuff used to happen directly from the school system.
You're right, and it's challenging when you're relying mostly on grant funding to be able to fund the program. But I think the advantage of being a community health center and that not-for-profit, community-governed model is that you have the flexibility to really develop what the community needs. And that's what I love about this organization and any organization that runs the same way, is that you have that flexibility.